Distinguished guests, fellow academicians, ladies and gentlemen, good morning. My name is John, a Sierra Leonean from Southern Medical University, Guangzhou. I want to share with you my recent research on the topic, the effect of hydrogen-rich saline in neuroinflammation and mitochondrial dysfunction in a rat model of sepsis-associated encephalopathy. For a brief introduction, sepsis-associated encephalopathy is a dysfunction of the brain due to secondary infection that has no obvious clinical manifestation in the central nervous system, but however affects consciousness, disorientation, cognitive impairment, and sometimes coma. There are a few cases that has been reported about this disease in pediatrics, and therefore the incidence and mortality is not yet known as compared to adults, which is about 76%. However, the short and long-term consequences of this disease is very paramount in children, like poor academic performance, low intelligence, etc. And at the moment, there is no specific treatment for this sickness. Of course, as we know, hydrogen molecule is a electrically neutral, colorless gas that is produced by the intestine. It can penetrate so many barriers, including the blood-brain barrier, the placenta, testes, etc. Recent study, some of its characteristics include, like it is permeable to biomembranes, like the mitochondria. It is also not toxic, and it balances the body fluids, and of course does not affect normal metabolic reactions. It is also not flammable at low concentrations, and of course it promotes cell detoxification, cell hydration, and also strengthens the host immune system. Recent studies in sepsis have shown that this molecular hydrogen can regulate so many signaling pathways. By regulating inflammatory cytokines, also improve mitochondrial dysfunction, as well as regulate the activation of astrocytes as well as microglia. However, there are a few studies recently in terms of the effect of this molecular hydrogen in pediatric patients model. And so our aim was to investigate if it had a similar characteristics in terms of regulating these inflammatory cytokines in pediatric animal model. Our study involved two aspects. First, at cellular level, we see the different effect of molecular hydrogen at different concentrations. As you can see here, from 0.2 to 0.6. And of course, we established the SIEH model by injecting animals with LPS or lipopolysaccharide. And then therefore, we assess the following parameters, such as electron microscope of the mitochondria, and of course, analysis, ELISA analysis of inflammatory cytokines, immunohistochemical analysis, as well as Western blot analysis of related proteins. These are some of the results that we've got. Figure A here shows the neurofunctional of animals after we have established the sepsis model. We can see that in the septic group, their function was decreased as compared to the intervention group, which was significant. B here shows the survival of animals after we have established the septic model. We see that it was decreased in the septic group as compared to the intervention, which was significant. And thereafter, we also assess the number of normal neuronal cells. As we can see here, this is the cortex and also the hippocampus. We see that both aspects were decreased in the septic model as compared to the intervention. And when we did statistical analysis, it was significant. And this one shows the effect of molecular hydrogen in terms of regulating these inflammatory cytokines. First of all, in terms of the concentration of molecular hydrogen, we see here this one, we tested TNF alpha or tumor necrosis factor alpha, of course, also this one interleukin 1 beta. We see that both were increased in the septic model as compared to the intervention group at different concentrations. However, interleukin 10, which is an anti-inflammatory cytokine, it was decreased in the septic model as compared to the intervention group at different concentrations. Also, we tested their expression levels in terms of the time interval of treating animals with molecular hydrogen. We see that at 1 hour, 5 and 3 hours, and then 5 hours, 10 hours, we see that all have both effect in terms of regulating these inflammatory cytokines. However, after we established the model, we gave hydrogen 1 hour. It was more effective in terms of regulating these inflammatory cytokines, and it was statistically significant, I can see from these diagrams. Following, we also test the expression of this astrocyte. We use this a marker, which is GAFP, which is a marker of astrocyte. We see that in the septic model, its activation was increased as compared to the intervention, both in the cortex and hippocampus. We do statistical analysis. It was significant, as you can see both here. It was increased in the septic model, but decreased in the intervention group. Similarly, also, we assess the activation of microglia. We use IBA1, which is also a marker for this types of cell in the brain. We see that this marker was also activated in the septic model compared to the intervention group. Of course, similarly, so the statistical analysis was significant, meaning that molecular hydrogen can regulate the activation of these cells in the brain during inflammatory activation. And this, we assess the function of the mitochondria. First of all, we assess the content of the ATP. We know that mitochondria produce ATP, the powerhouse for every cell, living cells. We see that in the serum and of course also the tissues, both the ATP content were decreased in the septic model as compared to the intervention group, which was statistically significant. We also assess the function of the degree of damage, the degree of damage of the mitochondrial membrane potential. We use JCU1, which is a marker. It's a dye that we use to assess how the mitochondria, the degree of damage is being caused. We see that in the septic model it was increased, meaning that the mitochondria was damaged. However, in the intervention group it was decreased. We also assess the release of reactive oxygen species, or ROS. ROS. Similarly, it was also elevated in the septic model as compared to the intervention group, which was significantly effect in terms of regulating this mitochondrial dysfunction. At a microscopic level, first of all, we assess the number of mitochondria as well as synapses. We see that both were decreased in the septic model as compared to the intervention group. We also see that it was, in terms of the membrane of the mitochondria was damaged in the septic model as compared to the intervention group. These are the protein levels that we assess also that have similar effects. In summary, we are also able to establish this model in pediatric model because it has not been done before. We also see that it was effective in terms of regulating these inflammatory cytokines. Of course, we also show that early treatment with this, this molecular hydrogen was more effective than when given later. These are some of the papers I already published in regards to this topic. Thank you for your attention.
Very good studies. So my question is, in your studies, you used the cell culture. So what kind of cells do you use? In primary cells or cell line?
It's a cell line.
Cell line.
You call it SH5S1.
Okay.
SH5SYH is a cell line. It is a derivative of the macrophage cell. Yeah, macrophage cell, yeah.
Thank you.
Yeah.
Thank you. We're already behind schedule. Thank you, please.
Okay, thank you.